In this video, I'm going to review my go-to exercise progressions for the squat. But before we get into the exercises themselves, I just want to set up a few things. First off, we need to recognize that the squat is one of these exercises that often gets analyzed and debated to death. And I think this is partially due because there's many different applications of the squat, both in terms of fitness and high performance training, or certainly with respect to injury and rehabilitation. And I think it's also due to the fact that there are so many different variables that can be considered or even manipulated with respect to how a squat is performed. For example, things like foot angle or positioning, trunk angle, squat depth, knee, lower extremity alignment, and so on and so forth. These are all things that are talked about or even argued about with respect to how a squat can or even should be performed. Now, to be clear, I am in no way saying that these things never matter, but I would suggest that when it really comes down to understanding what the goal of the exercise is in question, we simply kind of need to think about what we're trying to accomplish with this exercise. And when it comes to the squat, I think there is also something to be said for keeping things simple, especially when we're dealing with a population that is perhaps a little less knowledgeable about their body mechanics or don't maybe have a great sense of body awareness. And this is often the population that we're dealing with the treatment or rehabilitation setting. So with my squat progressions and the progressions I'm going to show here, let me try to provide you with some basic background about what the exercise progressions are trying to achieve. So first, I'm typically going to use this progression with knee pain patients, either as part of a general knee strength and endurance program or to specifically target the knee extension mechanism. This would include quad injury or tendinopathy, or simply a general weakness or intolerance with weight bearing. So in other words, the primary goal is to create basic loading progressions to target knee extension. So if this is my goal and I want to simplify these exercises as much as possible for myself and my patient, I'm not necessarily concerned here with specific trunk positioning or making sure the glutes are firing or activated. In fact, it's really the quadriceps I'm trying to focus on here. And this is why I am almost always going to prescribe this as a ball squat exercise. And whenever necessary, I'm going to have the patient use the upper body for support and balance. This is my way to simplify the exercise and keep the focus on creating load through the knee and through the quadriceps group. Now, the last thing I want to point out before we get into the exercises themselves is that this is a progressive exercise track. So in other words, this is really essentially a group of the same or similar movements that are arranged in order of increased difficulty or increased load demands. Now, this really does a few key things. It allows us to easily find the right effort level for each patient. This, of course, is critical. If the exercise is too easy, it's not going to provide the strength stimulus that we need. But if it's too hard, it's going to affect the quality of the exercise and may even flare up the condition. So by thinking of exercises as tracks or progressions, it helps us to know where to start with each exercise, but it also helps us to know where we're going with our prescription for each patient. As one exercise becomes too easy, we can then progress the patient or client to the next exercise in line. Now, as these progressions are just slight variations of an existing theme, it's also helpful because the patient doesn't have to learn a completely new movement every time we want to progress them. And finally, as each progression represents just essentially a small increase in load and physical demand, it minimizes the chances of flaring up the condition. So with that said, let's move on to the exercises themselves. The four progressions we're going to cover are the basic bilateral ball squat, the ball squat with isometric shift, eccentric ball squat, and finally the single leg ball squat. And just as one last reminder, remember, if you are a My Rehab Connection subscriber and you use our exercise prescription software, you can certainly find this progression in our exercise library. You can either search for each exercise by name in the library itself, or you can find it in the exercise group section under the title Knee Strength Progression, Ball Squat Progression. All right, let's take a look at the exercises. All right, let's start with the first exercise progression, which is just going to be our basic bilateral ball squat. So I'm just going to stick a ball against the wall, and I'm simply just going to lean back. The ball is right around my kind of tailbone or pelvis area, and I'm just leaning back onto the ball for support. For here, I'm typically just going to have my feet slightly in front of my hips, just so I'm leaning back into the ball. As we drop down, this will prevent too much shearing of the knee itself, and it also really helps to focus on the quads, which, like we said before, is our primary focus with this version of our squat progression. So from here, feet planted on the floor, I'm just simply going to have patients drop down as low as they can, but they're within comfort and they're certainly keeping within control. At the bottom, they are going to pause for just a second or two to really get that load and get that control through the quads and through the knee. Then we're just coming back up to an extended leg, standing tall position. Now, like we said before, I really want to simplify this and keep the focus simple for my patients. I'm not going to get too bent out of shape about lower extremity position. I do just want to make sure we have some general alignment, hips over knees over feet. So as I'm dropping down, I want to make sure there's no massive rolling in of the feet or the knees, and just generally keep this kind of straight alignment. I'm going down, hold for a second or two, come on back up. Nice and slow, going down, really control the movement. Hold for just a moment or two, and then back up. All right, so for our first progression past our basic bilateral ball squat, we're going to create an isometric shift or hold at the bottom of the motion. So we've got our same setup. We're leaning back into the ball. Now for this, we are much less concerned about a balance component here. So I am going to have the patient or client hold on to something to take that balance out of the equation. This can simply be the wall beside me, like I'm doing here, or if we wanted to bring a chair or even a balance stick or pole over here, that would be perfectly acceptable. So again, same basic position that we talked about with our basic bilateral ball squat, but here I'm going to drop down nice and slow. Weight is evenly distributed on both legs. From this lowered, dropped position, I'm going to then shift weight onto one side. I'm going from 2 points of support to one. Now in this case, I really feel a lot more sort of load through my right leg. I'm going to hold this for a couple seconds. Other foot goes back on the ground, so I'm bilateral support, and I'm coming all the way up, straight into the top, legs extended, fully standing upright. Again, slowly down on 2 legs. I'm going to shift my weight onto the desired side. Make sure I'm going slow with the shift, accepting the weight. Hold that for a couple of seconds without moving through the knee itself. Bilateral support again. Coming back up, fully straightened position. So our third exercise in the progression is the eccentric ball squat. So again, same initial starting position, leaning back against the ball into the wall, feet slightly forward, everything pointing straight ahead. Again, I'm using a wall or chair for balance to help support me during the exercise. Now here I'm leaning into the ball, but now to start the exercise, I'm going to lift one leg. So now I'm unilateral support or single leg here. Now I'm going to go very slow, dropping down into that squat position, feeling that stress and load through my leg, holding a couple seconds. Other foot back on the ground, back to the start. So again, this is always a down on one, hold for a moment, accept the weight, other leg gets put back down, up on 2. Lift, Slowly down on one, as deep as you can go, but keep it comfortable and keep it controlled. Accept the weight, pause for a second or two, bilateral support, back to the starting position. All right, so final exercise in the progression is just our basic single leg squat. Now, as a general rule, this is really where I would like to get with each patient. It may not often or always be possible, but it is certainly my goal. In my opinion, this is one of those exercises where having the strength and the ability to do a single leg squat really does help to become a preventative or just a general health exercise to maximize health of, in this case, the knee, but really in general of the lower extremity as a general unit. So again, same concept. Leaning back into the ball, using the wall, chair, or stick for support as needed. Lifting up one leg, we're going to go very slow, dropping down, bending the knee, accepting the weight, low as you can. Hold for a second or two. Now we're going to go slowly back up. So here we're simply single leg the entire time. Slowly back down, really control that motion, feel those quadriceps muscles work. Accept the weight and pause. Slowly back up to our starting position. Slowly down. Hold for a second or two. Back up to the starting position. So now that we've reviewed the exercises themselves, let's take a moment to talk about programming and progression criteria. First, as we're trying to target strength, we need to make sure we are creating a sufficient exercise stimulus. So here we're typically going to prescribe 3 to 5 sets per session. And instead of prescribing a specific number of repetitions, what I'm typically going to do is have patients perform exercises to fatigue. So in other words, what I'm going to tell my patients is to perform as many repetitions as they can. But here I'm not going to go past the point where their form breaks down or where they feel they are no longer in control of the movement. I also want my patients to keep track of their numbers, because that is largely how I'm going to determine if they need to progress the exercise. Or in some cases, we may even need to regress the exercise if it flares the condition up. So what I'm typically looking for here is I want each patient to be able to work within sets of 8 to 15 repetitions. If the exercise flares the condition or they can't perform at least 8 repetitions, I'm likely going to regress the exercise. Likewise, when they can easily perform 12 to 15 repetitions, I'm going to move them to the next exercise in the progression. Now, in terms of determining frequency, we also need to build in adequate recovery. So essentially what we need here is a minimum of 1 day between exercise sessions. So that means they're going to perform these exercises 2 to 3 times a week. I should also point out here that these exercises are not going to be the only ones they're performing. So within this strength session, these squat progressions may be part of a general knee strengthening routine or circuit, which may include hamstring exercises, knee rotation exercises, or maybe even some hip or ankle exercises. Now, lastly, let's talk about planning and programming over the course of an entire week. Remember, these strength exercises are important, but these patients will also likely be performing mobility and control exercises, which really form the basis of most of our exercise prescription and our approach to patient care. Now, these types of exercises are typically done on a daily basis. So for our example here, we are typically using this squat progression for knee pain patients. So I will also have these patients performing our basic knee mobility and control movement sequence once a day or maybe even twice a day. Then 2 to 3 times a week, I'm also going to plug in these strength or endurance exercises to target that aspect of their treatment as well.